spiel on AAs.
Is there a good way to tell a veterinarian? Skip and I were going to go on a long trip,
Yeah.
like to San Diego, and we had a pretty anxious little dog, and we went to 2 different vets who recommended acepromazine, and we knew. I mean, we read all about it and said,
Yeah.
but you don't want to question a veterinarian on that.
And I don't know that because even, you know, I have that problem too when I'm talking to other veterinarians. I might get away with it a little better, like they might be might be a little bit more open to hearing it from me, but they're, you know, people are so set in their ways, so it's hard.
They said we'll just call you.
Like, I feel like composure in a lot of ways has taken the place of acepromazine. Number one, it's not a prescription. It's very safe. Now, I did have one dog, so I know this certainly might happen in other dogs who, although she was kind of a special case. One dog who had a paradoxical effect, meaning she became very excited on composure. And her hypervigilant was how she described it. The dog was just, you know, really vigilant and definitely was due to the composure. So that is by no means a typical response, but that's why you always, anytime you're looking at going on a trip or something, try to give them whatever you're going to give them for the trip. Give it to them before the trip, so you find out if your dog has any weird responses. Please don't wait for the day that you're leaving on a big trip, or you know, the day of the storm, or the day of people coming to visit. Whenever you need some intervention to find out if it works or not, try it ahead of time. You know, I actually have a whole separate lecture on like psychopharmacology and how it works, and I left most of it out for this because it does get really boring. But so if you're ever interested in learning more about that, I'd be happy to do that. But yeah, you kind of have to, like, you gotta take your coffee beforehand, and you gotta brace yourself a little bit. It's really interesting, like if you can like just not let the word neurotransmitter kind of go, like I don't want to listen, and glutamate and GABA and all these, you know, neurotransmitters and their receptors and everything. If you can like prepare for that as being interesting, it can be really interesting. So I kind of just stuck in some other things about when I'm using pharmaceutical intervention for behavior cases. If I'm using an SSRI, those are the selective serotonin reuptake inhibitors, so fluoxetine, Prozac, sertraline. Those are some ones where you want to withdraw slowly, so never just cold turkey shut off the anti-anxiety medication. Although things like alprazolam, things that are a little shorter acting are fine, but the ones where they need to be on it for a while and it takes like 4 to 6 weeks for it to even have a benefit, and then you got to wean them off it. Because if you cut them off cold turkey, they can really have some weird things going on in their brain and not feel so good. I guess important to have informed consent that any of the prescriptions for behavior, so when we talk about prescribing drugs for dogs, we want to use labeled drugs that are labeled for the use of this medication in this situation. As an example, Clavamox. You've probably heard of Clavamox. It's an antibiotic. It's labeled for the use of bacterial infections in dogs. I'll give you a background. The drugs that I'm using, like fluoxetine and alprazolam, that's all considered off-label use. Those aren't drugs that were developed for the use of anxiety in dogs. So technically it's off-label. We know it can be used very safely. There are a lot of studies that show it's used very safely, but technically I have to let people know when I'm prescribing a medication that is off-label use. So you kind of know that we're kind of officially stepping off